of One Health lessons, and also have had quite a varied history already in my years as a veterinarian since I graduated from Tufts University in 2012. So what we're going to be talking about really is something that you don't learn in school. And what I'm going to do, the lessons learned from this talk is really lessons that I've acquired, lessons learned that I acquired since being out of school. We're going to be talking about Science Communication 101. Now that might sound fairly boring, but just trust me, it's not. It's very, very interesting and very important, because ultimately it's you are only as good as a scientist or as a veterinarian or whatever else you identify yourself as if you can communicate your ideas with another person. So it's Science Communication 101, but in real life. And so I have worked on Capitol Hill in the United States, working in Congress during during impeachment, during the onset of the pandemic, civil unrest, during all of the turbulence you can imagine since October of 2019. There, I was hired through the American Veterinary Medical Association as the Congressional Fellow, and I was trained by the American Association for the Advancement of Science, which is ultimately the group that creates the science magazine or journal. So if you know of the two major scientific journals out there, there's Nature and there's Science, and these are the science folks. So they trained me. And I worked in the office of Senator Dianne Feinstein, who is the senior senator from California. You may have heard of Kamala Harris, who is the junior senator from California. And excuse me, Senator Feinstein has been working in the Senate in the United States federal government since 1992. She has broken so many glass ceilings for women. She was not only a phenomenal leader for me to observe on a daily basis throughout the year, but she's also been a role model for me as a woman who wanted to go far with her career and her life. So it was absolutely wonderful to work in her office. And now I'm the founder and president of One Health Lessons. A little bit of backstory, because that first slide didn't just happen for me. It certainly took a journey. So I've, of course, always been interested in nature and in animals. And you can think of, with your veterinary degree, all of the different things that you can do. And you could say, okay, is this normal? Well, ultimately, you decide. I worked in small animal hospitals, worked with farm animals, did research with chickens that was in Tanzania. I was, of course, trained with large and small animals. I've taught, of course, doing surgery, and I've also worked as a first responder during natural disasters. This photo was taken outside of one of the shelters where I was working. I was managing over 300 animals' care each day because they were being displaced by wildfires. If the smoke wasn't here, you would have seen a tarmac in the back with airplanes, because this was at an airport. And also I worked in Thailand as a professor, teaching students who want to become veterinarians, and we were working with elephants, dogs, and cats, and the like. But not only have I been passionate as an educator for clinical medicine, I'm also a passionate educator for One Health. And that's what brought me, after doing my 10-hour shifts in the hospitals, I go home and I create lessons for children to teach them about One Health. Now, before being a veterinarian, I was already teaching. I taught music to primary school students. I taught English as a second or third language for both secondary students and adults. In addition, I taught math, or I tutored math for adults, even before I taught primary school students about music. So I was all over the map with education, and I've always enjoyed teaching because I feel like you can really make a difference in somebody's life if they can acquire an extra skill from you. So I created these lessons after going to the hospital, for hours on end, going home, making these lessons, and then on my days off, going into classrooms and teaching these lessons. And this was a picture of me, I think in 2018, in a classroom in California. And I was teaching them about clean water and the importance of avoiding some particular type of waterborne disease. Of course, while I'm thinking about it, you're welcome to look at the social media and join and subscribe to the YouTube channel, like, and add yourself to the Facebook, Twitter, all of the social media. And I think we're also adding TikTok soon, so be aware of that. So One Health Lessons originally was just me teaching students on my days off from clinical medicine. But when COVID came around, and at that point I was working with the United States federal government, I was working in Congress. I was getting paid through the American Veterinary Medical Association. The pandemic changed a lot of things, and I realized that back in February, a lot of people will be learning from afar, virtual learning, and the teachers are going to most likely be having a really hard time with managing all these students and also having high quality learning material to teach to these students. So that's why I launched on May 1st of 2020, onehealthlessons.com. And you can go to this website. You can see the bats flying in real time. This actually was a video taken in a city in Australia. Originally, there was a very large forest before that city arrived. And now that forest is now at half a block. And these bats roost in this half a block forest. So you can see in this video, that's the back of the header of the very first page, exactly what we are doing to the environment and how that can influence our own health. You can, of course, see the lessons. There are 7 different age-appropriate lessons that are based on COVID-19 in the lesson section. They are currently being translated into 77 languages today by hundreds of volunteers around the world. And the lessons teach 3 main things. Number 1, where the virus likely came from. Number 2, how to protect yourself today. And number 3, what scientists are doing around the world through teamwork and collaboration, how they're working together to make sure people stay safe in the future, as in developing vaccines, developing therapeutics, trying to improve environmental health so that way people don't get sick from these wild animals that are coming out from a habitat that's being destroyed by people. You can see webinars, of course, parent and teacher reviews, learn about the interns and myself, and you can see various blog posts. So the whole reason why we're speaking today is I really want you to become good science communicators. I remember I met a person who, let's say, had very high stature. Okay, he was very well respected in the veterinary community, and this was a very large conference, and he was kind enough to set me aside. We spoke for about 10 minutes. And when I told him that I was going to start in Congress and I wanted to talk about One Health, he said, "Don't bother." He said to me, "It's impossible." And I said, "Why?" He said, "Because it's too complicated." I said, "No, I've been teaching children. It's okay." And he goes, okay, well, describe to me in 10 seconds what One Health is. And I took a deep breath and I said, One Health is the connection between human health, animal health, and environmental health. And he paused and he looked at me and he said, okay, that was under 5 seconds. So ultimately, it comes down to what you can do to convey a message concisely. Now, keep in mind when I talk about One Health, and I want to keep it as concise as possible, I do not necessarily include plant health, but when I use visuals, I include plants in the environmental section here. Now, when you talk about the One Health approach, the best way to explain the One Health approach is teamwork between people who care for people, animals, and the environment. Done. The One Health approach is teamwork, right? The One Health approach is people of various strengths, disciplines, backgrounds. We all come together at a table, metaphorical table, and we talk through our problems in order to solve complicated issues like a pandemic, right? If you think about COVID-19, that would, of course, include veterinarians because, well, to develop a vaccine, you have to have lab animals involved, plus veterinarians because of the ecological factors that are involved in disease transfer with zoonotic diseases, physicians, of course, but also social sciences, scientists, people who work with branding and marketing. And the reason why I say that is think about how are we going to pitch the idea of a vaccine to all of these people of various backgrounds? How are people going to be viewing the need for boosters for vaccines? I'm legitimately concerned that there's not going to be, and because I haven't seen it, strong educational efforts, at least in the United States. I'm curious about in the UK if it exists, but of educating the public that there's a good chance that people will need a booster shot for the COVID-19 vaccine. And when I say that, it's because chances are we'll need a booster. Chances of people agreeing to going back to the doctor to get a booster, that might be low. And then people will start to not trust the vaccine if they think that the vaccine's too weak that you need a booster. They won't understand that through the immune system, the reason for boosters is because of our immune system, not because the vaccine's a problem. Do you see what I mean? And that comes down to science communication. Now let's talk about One Health and the way I explain One Health to children, just to drive home the message. We already said it's environmental health, animal health, and human health. But let's go through it with a story because stories seem to stick better with people. This is a healthy forest. The sun is shining and all the trees are getting equal opportunity and access to the sunlight. The water is clean. All of the animals are thriving. There's little shelter, competition for shelter, and there's little competition for food. And then something changes. People come in, they change the environment. They either chop down the trees to help with their own timber, or making charcoal, or perhaps influencing climate change. Either way, the environment's changing. It demands a bit more, and the forest is starting to shrink. Well, when the forest starts to shrink, think about how that affects the animals. It increases their stress levels because they have to compete more for space, for food, for shelter. And sometimes these animals are being forced out of this highly competitive area and being brought closer to people. And whenever that happens, think about the risk of disease transmission for zoonotic diseases. Now, most of you know that the vast majority of infectious diseases from people come from animals. So this is a real concern. And if we add more people to the equation, then the forest starts to shrink. The risk of infectious diseases transmitting between animals and people go up because there are more animals near people. Now let's say, for instance, one bird leaves because the competition's just too great. Let's say we take it one step further and say all of the birds of all types go extinct. There are a lot of consequences when birds leave. Number one, there are less trees. Because some birds are seed dispersal birds, right? If they are gone, then there's going to be less regrowth of the forest. Other birds, like hawks and eagles, they eat rodents. And so when the predator leaves, the prey goes up. And then because foxes eat rodents, well, then the fox population blossoms. And then now look how many animals are near people. That's really not a good situation. And that's how biodiversity influences risk of pandemics. You might have heard people saying, oh, we need to really care about conservation and biodiversity because our health relies on it. Well, this is why. Not many people actually tie those two things together. But if you think about the food web, if you think about consequences of our actions and how everything's connected through, say, One Health, then it really makes sense. And some people say, okay, well, I heard that bats are the root cause of this and so many other diseases. Why don't we just get rid of all the bats? Well, that can be a huge concern because some bats are keystone species, which means that if the bats leave, then this entire screen would go white. Nothing would survive. The entire ecosystem would collapse. So it really comes down to respecting our distance from wild animals, knowing what we can and cannot do to our environment, and educating others so that it's not just you who's taking action, it's the rest of your community. And that's how you change society. You educate them. Now, fortunately, these lessons that include those slides have been translated, like I said, into many different languages. And at this point, translations are in 77 languages. Now, we talked about why educating other folks is important. We're going to be talking about how you can actually do it. Think about this. When you compare how you talk to your friends versus your classmates that you're not really friends with versus your professors, think for a moment, what's your approach? Are you more goofy with some than others? Do you feel like the relationship is a little bit more intimate than others? What's the best way to speak to one friend versus the other? Now, comparing that technique, how would you then speak to, say, a group of 13-year-old children? And taking that one step further, how would you speak to a senior politician at the federal level? So say, speaking to somebody in the House of Lords, for instance, in the UK. If you don't remember anything else, I want you to remember this. Education is the same thing as communication, and communication is the same thing as education. We'll dive into that a little bit. There are three main steps of communication that really drive home your message. Number one, you have to do your homework. You have to understand your audience, or else it's so easy to miss the mark in the message that you're trying to deliver. Number two, identify the need of that person you're speaking with. And number three, practice your pitch. Practice what you're going to say to that person if it's a really important message, but don't memorize it. Let's tear that apart just a little bit more. Do your homework, otherwise known as understand your audience. Why is the person you're speaking with in their current position? If you are speaking with a senior politician, why is that person in that role that he or she was either elected or appointed to? Why did they even want that job? What's driving them? What are the current stressors in their environment? Certainly, if we're talking about speaking to politicians, there are a lot of stressors. All you have to do is pretty much read the news or watch the news, and you can see what's out there for your particular audience. Another thing to think of is if you're speaking with teachers, for instance, if you want to say, talk about One Health to teachers, and One Health is such a new concept to everybody else outside of this group that it's a hard thing to explain unless you use the technique I explained earlier that took 5 seconds. So the teachers right now, they're stressed, right? I'm talking about grade school and tertiary education, university teachers. They're stressed. They're not accustomed to teaching online, now more so than before, but it's a whole new world. And there's less funding for universities, given that there are less students now enrolling in universities, it seems. Going back to the politicians, depending on where you live in the world, depending on if this is, say, like in the House of Lords, they're political appointees. Well, the House of Commons, they get elected, but it's more like you choose your party and they get elected that way. But either way, if somebody is reliant on their constituents or their voters, and that's the way it works in the United States, make sure that you're aware of really who's the largest stakeholder you're trying to influence. If you're speaking to a politician of a large state, make sure that large state is most likely in agreement with what you're saying, or even better, what you're trying to explain to the politician would benefit their state. And remember, there's always a reason for why somebody does something. There's always a reason. So take, for instance, this picture. I took this picture in Nepal. I was sitting at a cafe and I turned around and I saw there were 3 elephants walking by. Now, you may or may not know, but when you have people on elephants, that's because these elephants have been broken, just like a horse early on in their life. So they go through, at least elephants go through some horrendous treatment to pretty much break their spirit and allow another living thing, so a person, to be on top of them. So knowing this, I could have very well gone over to them, said in Nepali, get down off of that elephant. That's not the right thing to do. Or the other option is understand, why are they with the elephants? Where are they going? What's the point of these elephants for that family? There's always a reason why somebody is doing something. These elephants could have been owned from the family and it could be a legacy, a tradition, or they could be going to the forest to lumber, to tear down some trees and provide funding for the family. Now, in certain areas of the world, that's not legal, but this photo was taken a long time ago. But until you understand the backstory of why somebody's doing something, you won't necessarily be able to deliver your message efficiently. If, say, they're using these elephants because of money, maybe it's worth having them become educated with another skill where they can make money another way. You see where I'm going with this? Always know the backstory to the best of your ability. Do your homework and identify the need of that person. Now, I felt like with this picture, it would be better to put the queen there as the senior most, political head versus, the prime minister or whatnot. So plus she was in blue, so it worked out well. And then right on top of my face is a mirror representing you. Ultimately, whoever you're speaking with, the same thing holds true. Identify what is important to your audience and how does that play into One Health. I'll give you a story about my experience talking about One Health on the Hill, on Capitol Hill in Washington, D.C. in a little bit. But ultimately, know what is important to the person you're speaking with. You can only imagine that the Queen has various interests and priorities, and these 13-year-old children certainly have the same, or different priorities, of course, but the same long list. Lastly, when you have an idea that you want to share, before you reach your target audience, you practice your pitch. You can get very challenging friends to push you to your limit. And what I mean by that is you practice your pitch, you explain what you want the other person to hear and learn and do, and then have your friends say, no, I'm not going to do this because of X, Y, or Z. And then you have to try to convince your friends to eventually be on your side. Practice, practice, practice. And a good way to practice is with Toastmasters International. I don't know if you're familiar with this group, but it's in over 120 countries that I'm aware of. And they call themselves a public speaking club, but it's much more than that. It's a communication club. And why I say that is because yes, you do public speaking, but you also learn how to evaluate. You also learn how to speak on your feet. You also mentor. So it's not just public speaking, it's leadership and is also communication. When you have these challenging friends, make sure you can answer all those questions. And if you can't, what is your plan? What I've realized with being on Capitol Hill, working with the federal government and people coming in asking for lots of things, if I had a question for them because it wasn't clear on their part, and they say, oh, I'll get back to you about that. Well, then I would expect them to get back to me. I was surprised that I would say about 60% of people never actually did. And that loses confidence from our office, from our senator's office to, with these people. So if you can't answer that question, it's totally fine to say, okay, I'll circle back with you, but make sure that you actually do. Ultimately, you can imagine you can't memorize this. If there are people who are interrupting your pitch, the idea that you're trying to convey, it doesn't work, right? It really doesn't work. You need to know something inside and out before you share that something, before you share that idea. So that's where your friends come in. And we talked about science policy a little bit. Now, I said that I worked on Capitol Hill, but I didn't actually say exactly what I was doing. So I was a science policy advisor for the senior senator of California. And this was my world. It was very different than the animal hospital, but I was using my veterinary knowledge and One Health knowledge on a daily basis. You can look at this massive building, just like you would be looking at, Big Ben in London, and think, what on earth is going on in there? And then what is even policy, right? I guess the easiest way to explain what policy is that policy is a way to change others' behavior. A simple example could be putting a funding through the government, a mechanism to permit speed bumps in an area where people usually speed. So policy, again, is a way to change behavior. Let's, as we call it on the Hill, unpack. Again, we talked about the 3 steps of communication. Do your homework, identify the need, practice, but do not memorize. Okay, so now we're going into the deep end. We are talking to senior politicians, and we have already done our backgrounds, our backstory, our research. We've already done our homework, right? And we learned that the person we are going to be speaking with has, say, a medical training background. They're a physician or they're a veterinarian. At least in the United States, there are 3 elected officials who are veterinarians. There was a full-time staff member of 1 senator who left the office back in February. So then starting on February on, I was the only veterinarian in the Senate. So in case you don't know the layout of American legislative branch, a part of Congress, there's the House of Representatives, that some people compare it to the House of Commons, just because it's the lower chamber. And then the Senate, which is kind of the upper chamber, so that's kind of equivalent to the House of Lords. But the difference between Parliament in Great Britain and American congressional layout is that in the US, everybody gets elected. So getting back into this, the background of the politician, so the elected official, they could say have a medical training, or say their daughter is a physician, or this politician could be an anti-vaxxer or climate change denier, any of the things that you see written here. Okay, well, you can imagine you should be using different approaches to bring up the idea of say One Health to all of these different people. Here are the answers to what you need to use when you speak to politicians of these different backgrounds. We'll go through it together. So if somebody is a physician and an elected official, then it's totally fine for you as a person with some medical training, use some medical jargon, because ultimately it's kind of like an inside joke. It's kind of like a tip of the hat to their training. They feel more acknowledged and recognized as a medical professional. Now, if, say, their daughter is a physician, then it's always a good idea to express gratitude and value for the healthcare professionals out there. When I say that, even if you are trying to pitch the idea of, I don't know, climate change, for instance, you could start your conversation by just saying something like, oh, these healthcare professionals are really having a hard time right now with COVID. My heart goes out to them, something like that. Just so that it gets some buy-in from the person you're speaking with. For the anti-vaxxers, I would avoid at all cost any discussion of vaccines. You're not going to be changing an anti-vaxxer overnight, but it doesn't mean that you can't have that person on your side for something else. For climate change deniers, and this actually is something that I was dealing with on Capitol Hill. So I might as well, no, I'll go over that a little bit later. But climate change, you can change those words because they're very politically charged to changes in the environment. AMR, or antimicrobial resistance. If you want to talk to somebody with AMR background, then you can particularly speak about how AMR plays into public health and economic impact. And you can talk about, oh, well, that's kind of the same thing as what we're dealing with this infectious disease. Maybe we can allocate some more federal dollars to help push more public health training. Yes, in AMR, but also in infectious disease detection, surveillance. So this is just an example again and again of how you can use somebody else's background to your advantage, to your mission's advantage. And one thing in particular I wanted to highlight is if there's somebody who's anti-science because of one reason or another, they just don't simply believe in it, then I would not go up to them and say, "Hi guys, I'm a scientist." No, I would work towards building a relationship, learning what their interests, their priorities are first. Go in with a very non-confrontational type of subject or approach, and learn from them. And then eventually you'll gain each other's trust. And then from there, you can hopefully convince them to appreciate science. And so ultimately, working with this senior senator from California, Senator Feinstein, I have learned how to throw the pitch to get people on my side, and that's the side of science. And let's go through an example. So I created a bill, and bills become laws. In this particular case, it was a bill that became a resolution, which is a public declaration of what the Congress, in this particular sense, the Senate, the United States Senate, feels about a subject. And so it was to make January of 2020 to be declared as National One Health Awareness Month. And I introduced the idea, the term One Health, to my boss, the senator. And she says, that sounds great, because she already knew about AMR. She already appreciated how a sick environment can cause sick people. So this term was not too hard of a reach for her to get to. So she says to me, that's great, but you need to get a Republican on this bill before we introduce it. And so in the United States, as probably you all know, the two major parties are Republicans and Democrats, and my boss was a Democrat. So we needed to get somebody from the other party on board. It wasn't so easy because this was during the time of presidential impeachment, which means that no Republican was really talking to a Democrat and vice versa. It was a very, very heavy lift. It was a very tall mountain to climb. And so I got started, and I took many coffee meetings, many meetings with people who are on the staff of other senators, particularly Republican senators. And I heard that in this bill that I wrote up, I had to change the words climate change, because ultimately there was not a single Republican who would sign on if the words climate change were there. So I asked, could we change these words to changes in the environment? And they agreed. Okay. But they agreed a little bit too late, because that particular office agreed 2 months after it had already passed, which means that that particular politician wanted to get credit for something that they didn't support at the very start. This happens sometimes, especially when you're up for re-election. So I had to find another Republican co-sponsor. And I did a lot of research. And I found somebody that cared about breast cancer. And she was very against animal testing. And she also cared about Indigenous communities in her state. So these are the 3 pieces of information that I took with me to this meeting. And I met with one of her staff members, and we were just introducing ourselves to each other. He knew ultimately what I was going to be talking about, this bill. And when I was talking about One Health, and he said, Deb, she really doesn't, his boss really doesn't support animal testing and developing medications and things like that. I'm like, oh, well, that's totally fine. The One Health is not, necessarily talking about animal testing. Let me give you an example, because as a veterinarian, I want to make sure that my patients stay as healthy as possible. And when I'm dealing with, say, a golden retriever with breast cancer, that breed of dogs actually has a type of breast cancer that's really, really, really similar to human breast cancer. And so as a veterinarian, I can have conversations with oncologists on the human side, and we can learn from each other. That's what I'm talking about for One Health. Teamwork. We're working together in order to save our patients. And of course, we all know that this is comparative medicine, right? But the idea of One Health is so general, so broad, that you can move it in any which way you want, tailor it to your audience. Last thing I mentioned, when he was starting to become interested, because that breast cancer example, I knew he didn't raise this point at all, but I knew that in that area of the country, there are several indigenous communities. And I told him that about 10 years earlier, and this is a true story, of course, I told him about 10 years earlier, I went to this Native American reservation, and I was working to make sure that these dogs were not bringing home ticks and fleas and the like to their human owners. And so it was really important, not only for the dogs to not have these ticks and be on good tick preventative, but it was also incredibly important for the children who are playing with these dogs, as well as the people who are living in the same homes as these dogs. So it's public health. And he didn't realize that vector-borne diseases was a concern for both veterinarians and physicians. So he said, okay, Deb, I'll take this back to the office and see what I can do. And within 48 hours, he came back and said, yes, we are a go. And from there, we had to convince a lot of other offices, but we did it within a matter of 5 weeks, which was pretty incredible, especially given that it was during the time of impeachment. And if you want to look it up, just Google Senate Resolution 462 and you will find it. And this is the fine print designating January of 2020 to be National One Health Awareness Month, which is pretty incredible because it passed on December 19th. And that was right around the same time as when the first case was truly recognized to be part of this pandemic. So crazy to think about. So the point of this is to promote awareness of organizations focused on public health, animal health, and environmental health collaboration throughout the United States, and to recognize the critical contributions of those organizations to the future of the United States. And so that passed, thanks to communication. Now, when we talk about One Health education, we are leaving the great halls of Congress and we're going back into the classroom. Again, what are the 3 steps of communication? Do your homework. Identify the need of the person. Thinking about the need for that Republican senator, she needed to be reelected. She was up for reelection. She needed to play well with Democrats. She needed to get as many people on board who are focused on indigenous communities. And she wanted to push even more on things like comparative medicine. Do not memorize. Do not memorize. Just know your pitch, know your idea, whatever you're trying to convey inside and out, so you can answer questions. Now, we already went over some good techniques to use for
Deborah,
politicians.
Sorry to interrupt. I think you're.
This is a good technique to use for children. Regardless of where, can you hear me now?
Yep.
Okay,
Okay.
great. Thank you. So regardless of where and when and what age you're teaching and how you teach, either online or in person, it's important to ultimately understand who your target audience is. And while it may still feel intimidating, and honestly, this looks like a picture from a James Bond movie, but it's actually a typical day, which is walking around where I was working. Just remember that you've done your homework, you understand the need of the person you're speaking with, you've practiced, and you have not memorized. Remember, education is communication. And actually, this is, in case you're ever wondering what's inside of this dome, it's this picture of George Washington surrounded by angels, which is really interesting. But ultimately, sometimes you just have to go for it and share your idea with that other person. Happy to answer any questions.
Hi, I have a question. First of all, thank you so much. This talk was super informative. I think as people who are interested in One Health, we know that there's not obviously enough education about it for most people. And so having these tools in our tool belt is going to be really useful. So as, again, people interested in One Health, how do you think it's best to get involved, especially for veterinary students in the UK? We have to do EMS. And so I was wondering if there are any opportunities you know of. I mean, you've done a lot of work in government or just One Health specific opportunities that you know of.
Yeah, and for the benefit of everybody, what is EMS?
I'm so sorry. It's extramural studies. So it's basically just veterinary experience during school.
Okay, and it's not just clinical. Right.
So the problem is that I know at the RVC specifically, we've had a lot of problems with upper years doing these EMS opportunities and trying to get opportunities that aren't just clinical, because obviously veterinary medicine spans so much more than just clinical practice. So, I mean, clinical and non-clinical, I mean, I'm sure there have been people that have done internships with like public health organizations or in government, and I know this is like a very tall order and kind of a broad question, but if there's like anything you can think of or avenues to travel down that you know of for students.
Well, I'd be remiss to not talk about the internship program that's with One Health Lessons.
Okay,
because
absolutely.
If you want a multidisciplinary, multicultural experience that I don't think you could find honestly anywhere else, this is the place to do it and bring your veterinary knowledge to help the planet. To give you a little idea of the internship program, we're now in the middle of the third class. Since starting, there were people of various degrees of where they are in their education. Some of them are professionals with postdoctorates, some of them are undergrad students. But coming from different disciplines, there's a law student right now, there's veterinary student, there's medical student, there's business students, there was an economics, also a statistics student, so all different backgrounds. But the locations, we've had Taiwan, Hong Kong, Ecuador, Canada, Mexico, US, North Macedonia, Ukraine, Nigeria, and Uganda. So how to communicate with people of various cultures and work towards a common goal, definitely consider working as or volunteering as an intern with One Health Lessons. Now, and that's all virtual, so you don't need to worry about the pandemic for this. Okay. Other opportunities for EMS during the COVID outbreak.
Yeah, right, that's a little hard.
That's hard because even the interns on the Hill, their internship was canceled
Really?
because of lack of opportunity to be there in person. So we have to start to think outside the box, and I'm just thrilled to have the interns working towards this common mission of educating every child on the planet to care about One Health. I don't know who just said that, but thank you. Please try to mute yourself if you can. So the other thing is there's a lesson leaders program, which is learning how to teach these lessons, not just in your community, but in other communities around the world. And if you are able to teach others later on in your development as a trainer and a teacher, then you become a One Health Lessons ambassador. So that's all virtual. So yeah, maybe Elizabeth, if you can mute everybody, that would be great. Thank you. And I think that answers your question at least.
Yeah, excellent. I know that was like a really far-reaching question. My other question is, I saw that you have, in addition to your DVM, a certificate in international veterinary medicine. And obviously with the work in One Health that you do you think that having that extra certificate, or perhaps like an MPH, or at the RVC we have a master's in One Health, do you think it's really essential to have that extra degree to kind of get these jobs in other sectors that might like involve One Health or public health or global health, or do you think that's necessary?
Yeah, really good question. So when I graduated, when I was in vet school, it was a different world than when you're in vet school. The certificate of international veterinary medicine that was given at Tufts University back in 2012, that had a lot of overlap with an MPH, but it did not require me to drive 4 extra hours in a week to go into Boston and out of Boston.
Right. Yep.
And it seemed to be too much of a headache, just logistically, because I was also like the head of the goat club and the head of starting the dental club at school and things like that. So certainly I learned about One Health because of the International Veterinary Medicine degree, or that certificate. I think it should be called something more than a certificate, but honestly, the year before, if I had graduated the year earlier, I would not even have had that as something on my resume because it was not an official certificate program. So the programs that are now in the making or already established, the Masters of One Health, that never existed. There was no One Health degree when I was a student. And to be completely honest, it has been an issue for me because people see a certificate and they're like, oh, that was like 5 hours of work. No, that was two different summers of research plus like 8 extra hours of schooling on top of the DVM degree. But that means nothing to somebody who doesn't know it, right? So if you can get a master's in something else in addition to the DVM, that will help open some doors.
Yeah.
I think I'm at a point now where I don't necessarily need that master's degree to have people want to start talking to me, but honestly, it was a huge uphill battle.
Absolutely. So you think going forward for people who are still in school, it'd be pretty worth it to get an extra degree in public health, One Health, global health to bolster yourself? Okay. Yeah. Thank you so much. And again, I really, really enjoyed your talk and I appreciate your time.
Thank you so much.
That was an awesome talk. Thank you so much. Does anyone else have any questions?
Hi. Maybe, so I think something Elizabeth and I have talked talked a lot about recently. It's like how we can introduce One Health into our lectures at the RVC. I think we find it that it's very lacking. And it seems like we kind of hit some bumps and roads when talking to professors about introducing this. So we were wondering if you had like any tips perhaps on how we can do this.
Yeah, I think honestly, the easiest way to go about this is by working off of the One Health clubs that you have after hours.
Mhm.
And if you can get a cohort of people in that club to become lesson leaders,
Mhm.
then you can go to your public relations and media sector of RVC and have them write an article about your wonderful accomplishments and being a part of this global One Health education initiative and movement, which is actually happening. It's a movement. It started off with me teaching these random lessons in California, and now it's like, bam, it's everywhere. And I'm incredibly grateful for all of the volunteers around the world doing this. And right now, there's no big hub in the UK, which means that there's a need for that. And if RVC were to lead such an event, then that would look incredible.
Yeah, for sure. Yeah, I think one thing, it's making ourselves more visible to the university.
Absolutely. So if you go on the YouTube channel, there's like a 3-minute video, I think. No, 5-minute video of what the Lesson Leaders program is. I don't know if you have an advisor for that particular group at your school, but certainly something to share. And I'm happy to connect further and help you out with that. But ultimately, it's helping you, and it's also helping the children in the UK learn.
Okay, thank you.
Yeah, thank you.
Alrighty, does anyone else have any questions? I had a question kind of going off of that, like, so I think one of the biggest issues we have when we talk to professors is that, everybody I think is very keen to be involved, but when we kind of start pushing towards, okay, like, what do we do? Everybody's keen, but like, how do we kind of move forward? That's kind of where we kind of get into a little bit of an issue, just because, what does that mean? Does that mean, making new lectures, and then, everybody already has a large workload, so how do we kind of get people to want to just work
well,
more?
the easiest thing is introduce me to the professor and maybe I could be a guest speaker.
Yeah,
and that saves them time and money and energy. And then I could deliver the idea of One Health. That's always a possibility. The other way is to, if you can't add set lessons and lectures, then the concept has to be spoken about on a general basis amongst the student communities at your school. And I think, as mentioned to, I think it was Rebecca, having people join the Lesson Leaders program would also drive up more chatter about One Health. The other nice thing, if you have relationships with other areas outside of veterinary medicine, like other student groups that you're affiliated with, like a medical, like a human medicine, or environmental, or even beyond that. Think about the people who want to become grade school teachers. Can you join any of their student clubs and bring the idea of what One Health is to them, and say, oh, well, there are free COVID-19 lessons and learning material online. I already know how to teach them because you're already a lesson leader. So let's go out into schools together virtually, wherever it's safe, in person then, and teach these lessons. And that's a really nice way to also perfect your science communication skills, which are going to be indispensable when you're a clinician, if you want to become a clinician.
Awesome, thank you. We'll definitely look into that and maybe try to expand our club a bit. Does anyone else have any questions? Nope.
I just have one more question. How did you get interested, or I guess involved in the policy side of vet med? And I know you applied for the fellowship. Did you just apply, or did you have kind of a position before that that led you to that?
Yeah, it's actually the first question that the AVMA asked me in the third step of the application process. How do they word it? What organizational veterinary experience have you had? You know, like what they're asking me, like what policy experience have I had, right? And my response was none, because if I'm going to devote myself to something, I'm 100% in, and I don't do anything halfway, and I don't have the time to do this, that, and the policy stuff. So, however, if given the opportunity to attain this position, then I'm all in, and you want me on your team because I'm that type of person. But as of right now, I have not experienced that.
Absolutely. So basically you applied, and obviously you got it and made it very far and stuff, but you just applied because you wanted to do it. Cool.
Yep.
Awesome. All right.
Yep.
Thank you.
Yeah, thanks.
All right, does anyone have any more questions? Okay, well, thank you again so much for that great talk. We will definitely put the link to this talk we'll send it out in an email and on our Facebook page and all that. And we'll put a link to your One Health lessons page as well for anyone that's interested. Thank you so much.
Thank you very much. I really appreciate this opportunity, and it was great to meet you all.
Great to meet you.
Thank you very much.
Of course. Have a good night.
Thank you.
Bye. Thanks.